while encouraging hope and faith. The title of this broadcast is Getting Help for Yourself. Getting help for yourself. And I'm kind of going to be using some notes from a booklet that we wrote called Thoughts from a Clinician. Getting help for yourself voluntary. I'm going to be reading some of the stuff that I wrote here and talking through it as well. Mental disorders are treatable, but many people do not seek out help until their symptoms become severe. And unfortunately, we see this all the time, that by the time a person comes, their symptoms are so severe that it requires a more severe response, okay? If you have come to the point in your life where you feel that you need assistance, then you are not alone. There is hope and support for you. If you present to the hospital, seek help and are admitted, then this will be considered a voluntary admission. Voluntary admissions can help to identify symptoms, clarify the diagnosis, and stabilize symptoms. So let me say here, if you're listening to me and you've come to the point when you feel or you think that you may need to admit yourself into the hospital for mental health concerns, then I applaud you and I would encourage you to do that. If you do that, then that's called what we call a voluntary admission. Going into the hospital, voluntary, can do a lot of things. Number one, like I said before, like I read here, it can help you clarify the diagnosis. You can get answers, especially if you also may be dealing with other chronic health conditions. And when we talk about mental illnesses, we're talking about medical disorders, okay, because a mental illness is a medical disorder. When we talk about severe and persistent mental illnesses, we're talking about chronic conditions. For those of you who follow this broadcast, you know when we talk about severe persistent mental illnesses or severe mental illnesses, we're talking about a category of mental illnesses that are so severe that they impact all aspects of an individual's life. We're talking about a category of illnesses that there's a federal definition. When we say SMI, it's actual a federal definition, a federal category of certain illnesses. Schizophrenia and bipolar, for example. But in general, I'm not necessarily talking about severe mental illnesses. I'm talking about mental illnesses in general. If you get to the point where you feel that you may need to check yourself in, then do so. Okay? There's nothing wrong with that. Just like if you were having a panic attack, if you were having a heart attack, or you were having some problems with your diabetes and you needed to go to the emergency room or you needed to be admitted, that's fine. There's nothing wrong with that. I think we need to get away from the stigma that by addressing your mental health concerns that means there's a problem. No, it doesn't, or that there's something wrong with you. Yeah, it just means that you need to get help, just like you would if you had diabetes or any other concerns. But I want to talk about what happens when you present for an inpatient or a psychiatric or behavioral health admission. Because it varies, okay? It varies really from state to state. It varies from city to city, town to town. It varies depending on whether the type of hospital, private, public, the type of insurance, the time of the day, believe it or not, or the day of the week. It just varies. So what I want to share is maybe some general things that may or may not happen. But so if you are thinking about going into the hospital or maybe that you may need to have an admission, then just kind of give you some ideas. What I was going to say before I sidetrack myself is that when especially if you have other chronic issues, say like diabetes or just other chronic diseases, that in addition to the behavioral health or mental health concerns, then going into the hospital may be the best thing, because you can kind of get the medications adjusted or kind of run tests and see exactly what's going on. But let's talk about this, getting help for yourself voluntary. As I said before, your experience at the hospital will vary depending on your insurance, the hospital, the time of day, your symptoms, if you are admitted involuntarily, and if you are already on medication. So a lot happens when you present there, okay? But just because you make it to the hospital doesn't mean that you or your loved one will be admitted. For example, if you're already on medications, the hospital staff may call your outpatient treatment team for information, make adjustments, and send you home with a follow-up appointment. So what am I saying here? Let's say I present to the hospital. Usually we're going through the emergency room and say, hey, I think I need to go into the hospital. I'm having some mental health concerns, okay? It depends on the hospital. They may call and say, okay, we're going to have somebody come down from the mental health to kind of evaluate you. That could be a clinical social worker. It could be a psychiatrist, whoever. Someone will come down and evaluate, okay? They will evaluate. And then they'll get a history from you. They'll talk about what's going on. And depending on, and it can go either way. So for example, let's just say you present to the hospital there, you're talking to the person, that's doing the evaluation, and they find out that you already have an outpatient doctor that you see, and that you do have medications, or maybe you ran out of medication, or that you ran out of medications. You have them, but you ran out. Or you have them, but they're not working. But that you have an outpatient provider. In that case, that doctor or that clinician, whoever, let's say the mental health clinician who's doing the evaluation at the hospital, may say, okay, so this person already has someone. They may get permission from you to call your outpatient doctor and say, hey, I have so-and-so in the hospital here. What medications do you have him on, or he or she on? And they have a conversation. And they may decide just to go ahead, okay, I talked to your doctor, or this is what we're going to do. We're just going to adjust your medications. We're going to let you stay here for a few hours in the emergency room and see how you feel. Or we're going to adjust your medications, and then we're going to let you go home. So they may not admit you, okay? So that's number one. Number two, what may happen, you may get to the hospital, and let's say you don't have an outpatient doctor, or you may not be on medications, or you were on medications a long time ago, and you may say, I just want to be admitted. They may talk to you, and they may still choose not to admit. They may say, okay, based on what you're telling me, you're feeling bad, you're a little depressed, okay, we're going to give you some medications here at the hospital, and then we're going to, in the emergency room, we're going to let you stay over here, stay for a few hours, maybe, a few hours to see how things go, and then we're going to send you home. Okay, that can happen. 3, this is the problem that where it can get tricky. You present to the emergency room, the mental health clinician comes down and talk to you, and you want to be admitted. Like, no, I want to be admitted. I do not want to go back home. This is where it can get kind of dicey, right? Or especially if your loved one, you bring in your loved one to the hospital, or, well, I'm sorry, I'm not going to deviate because I'm talking about voluntary, so I'm going to stick with voluntary. You're there, and you're saying, I want to be admitted. This is where it can get tricky because the doctor there may choose not to admit you for whatever reason. No matter you might want to be admitted, they may not choose to admit you because they don't see a reason. It used to be a long time ago, in inpatient psych wards, the beds are, no matter where you are in the United States, there are not a whole lot of beds. There are not a whole lot of, that's why I said it depends on the day. Like if you go maybe Tuesday, Wednesday, maybe Friday, probably won't admit you. There are not a whole lot of beds. There's not a whole lot of space. And some hospitals, some mental health clinicians, doctors, depending on where they are very particular about their beds, especially when they know it's getting maybe closer towards the end of the week and they expect a lot more people coming in. If you don't have to be admitted, they're going to try hard not to admit you, okay? Also keep in mind that it used to be a long time ago that you can go into an inpatient facility and stay forever, as long as you want to. Now, even if they admit you, they're not keeping you long because the expectation is with the new medications that we have now in 2023, with the new advances that we have now in 2023 when it comes to mental health, that the expectation is that you shouldn't have to be in the hospital for long periods of time. So that's the expectation. So again, if you get there on voluntary, you may be shocked to find out that the doctor doesn't admit you. That's what I'm saying, where I'm going. So you want to be able to make a case of why you need to be admitted. Some people, the magic bullet that people would always say is that I feel like I'm a danger to myself. I feel like I might hurt myself, right? I feel like I might kill myself now. And some people, I've known some people who said that, who really, that wasn't the case, but they said it because they wanted to be admitted. What I'm telling you is that when you go to the hospital, don't be shocked if you're not admitted. What you want to do is have an honest conversation with the doctor or whoever the clinician is about what's going on, okay? So again, just keep in mind that it's not necessarily like you go to, well, even at the emergency room, you go to the emergency room, you may, think you're going to be admitted, and the emergency room doctor is able to do wonderful things and send you home. It's the same thing with the doctor at, for psych, for mental health. And I hesitate because it's not always a doctor. It can be a clinician, a mental health clinician, okay? They may or may not decide to admit you when they do the evaluation. But if you feel that you need to be admitted, you need to make your case. You need to say, no, I need to be admitted. I need to be admitted. I don't feel safe. I need, this is what I need, okay? So just want to let you know, don't be shocked that you don't think you may not be able to march right in, sign in, check yourself in, and they say, oh, come with me. It may not go that smoothly, okay? Now, a couple of things that you want to pay attention to, that while you are in the hospital waiting to be seen, there are a few things to keep in mind. Number one, you may be seen in the emergency room first, unless previous arrangements were made, or you're in a place like in the District of Columbia, we actually have a psychiatric hospital. It's called CPEC, Comprehensive Psychiatric Emergency Admission Hospital, and that's all they do is deal with psychiatric admissions. But which means if you're going into the emergency room first, you may have to wait. Okay, but don't let that discourage you. You may have to wait to be seen because in the emergency room they do triages. You may be asked several questions. Well, you're going to be asked questions, but you may be asked several questions over and over again. So like the first person that you see, they find out, hey, what's going on as they triage you. Then they have you wait until, again, a doctor may come in to make sure medically, there's no medical concern that's going on, the run test, drug test, whatever. And then you're waiting for somebody to come down from psych, or the person that comes down from psych, maybe the person that runs the medical test. It just varies. Have some patience. Just know when you go there, it may be a wait depending on the time of day that you go. Now, if you have an outpatient psychiatrist on the outside, right, a clinician on the outside, you and that person may have already had a conversation. And ideally, that would be great. Because if you've already had a conversation with your doctor and both of you agree that, hey, it may be a good idea for you to go into the hospital for a period of time, then that doctor ideally is having you go someplace where he or she has some admission privileges, and you're able to kind of move the process a little faster, okay? Ideally, but that's not always the case. But just know it may be a process, it may be a wait, depending on the time of day that you go. If you're taking medications, know your medications. Know the name of your outpatient providers if you can. As I said here, the first doctor you see may not be the psychiatrist, because a lot of times that psychiatrist or mental health clinician is not just hanging around the emergency room, right? They're all throughout the hospital dealing with cases. So you may have to call, that person may have to come in. As I said before, even if you feel that you or your loved one is experiencing a mental health event that requires an admission to the hospital, that doctor or the hospital may not feel that way. So be prepared to make a case. So, yes, sometimes you may have to make a case for admission. I know it doesn't sound fair, especially in the case where there are very few beds. If the doctor thinks that you or your loved one can be stabilized with medications, and they'll adjust the medication, they'll send you home. Or if there are insurance issues, I know this sounds cruel, but if there are insurance issues and they think that you can go make it, then that's what you're going to do. You won't be admitted. Again, if you feel admission is needed, say so. But be prepared to explain why you're seeking help, right? I have a note here. Describe the symptoms you are experiencing and explain how those symptoms are negatively impacting your life, okay? This is what's happening with me, and this is how it's negatively impacting my life, okay? I have not been able to sleep And because I haven't been able to sleep, I'm not able to take my other medications. I'm unclear. I'm also a diabetic. I haven't been able to sleep. I'm not able to take, because I'm not sleeping, I can't take my medications properly. My diabetes is my numbers are shot because I can't sleep, because I can't eat. I'm not eating. I'm so weak. Because I'm weak, I can't take, you really have to make a case. And I know people are listening to me, oh, that sound, I have to do all of that. I've been doing this a long time, and I'm telling you, I've seen people, I've taken people, gone with people, right, and who should be admitted, and they're not admitted. We had a case here in Virginia a few years back where this gentleman was he was actually in the House of Representatives, and he took his son, he was, I want to say House of Representative. He was an elected official. So you would think an elected official went to the hospital, got turned away. His son, he was trying to get his son admitted, wasn't admitted, got turned away, and his son wound up harming, I believe it was his wife and himself. So this happens all the time. People go to the hospital asking for an admission. For whatever reason, they don't get admitted. Some people go back home and they wind up harming themselves, killing someone, harming themselves in some way. And then everybody's like, well, why? They were at the hospital. Why weren't they admitted? Because everyone who goes there is not admitted. You have to be able to make a case. If you go there and you feel like your loved one needs to be admitted, then you need to be able to holler, scream, do whatever you can. Say, no, I cannot take this person back home. But be clear. Why? Okay, I can't take this person back home because they're walking around, they're pacing, they're not sleeping. I'm concerned maybe about their safety. They may get a knife, or whatever. Or you may say yourself, I can't, no, doc, I can't go back. I need to be admitted. I need help, right? Because I'm concerned that I may hurt myself because I'm not sleeping. Well, whatever the case is, you need to be able to make the case. And sometimes you may have to, especially if it's a loved one, you may have to be a little passionate about it. Not necessarily aggressive, but you may be a little passionate about it, okay? Unfortunately, many people feel that the only way for them or for someone that they love to be admitted into hospital is to wait until things get bad, and sometimes that is the case, or say that they are suicidal. While this is still true in some cases, unfortunately, that there are other ways. Okay, there are other ways. If a person has a chronic health condition and the symptoms associated with a psychiatric illness, such as not taking medications, is keeping them from recognizing the need to manage their other conditions, then that can be a reason for hospitalizations, right? Are the symptoms disrupting other people? Okay, are there other people to the point that their lives could be in danger, or your life can be in danger? Then that's something that you want to bring out. Again, all I'm saying is just know that when you go to the hospital, it may not be as clear cut. Okay. At some point, let's say during you made it past the cut. Okay. During the admission process, you're going to receive a medical workup and be escorted to a room or a bed. Now, sometimes, depending on when you go, again, it could be hours. You may go straight from the emergency room to a bed almost immediately. You may have to wait somewhere I've heard of some people waiting for days to get a bed. So it varies. When you get there, you may be assigned a single room. You may have to share a room. Okay. Some hospitals look better than others. Some hospitals are nicer than others. I'll just leave that there. But it doesn't matter. You're there to get help. You may be concerned about your bunkmate, or you may be concerned about the people, or like, what is going on here, right? You're there to get help. Remember, you are checking yourself in voluntarily for a reason, because you want to get help. You want to find out what's going on with you. You want to get these medications adjusted. You want to feel better because you're not feeling safe. You just want to kind of figure things out. Let me say this, and some of you may or may not agree, but I'm going to say this. I already kind of told people where I'm located, but there are some hospitals who get a bad rep because that maybe they're not the hospitals that maybe the rich and famous use, but let me tell you this, I would put those hospitals up against whatever your best psychiatric hospital is that you can think of. I would put some of those hospitals in the same category as some of your best hospitals, okay? Because what you have in that's number one. Number two, let me get a plug for community mental health. I would put some of those community mental health clinicians in a top category than I would some of these people in private practice or some of these people working in some of these most prestigious places. Do you know why? Because when you're working in community mental health, you're able to, people there, they see it all. They see everything. We get all type of experience. We have an opportunity to learn and work and do so many different things. It's the same thing with some of these hospitals. You may go there and look like, this hospital looks like a dump, but the people in there, and it may look like a dump, but when you go there, the people in there are so advanced. Their skill sets are so on another level in comparison to some of these hospitals, some of these places where you go and it looks really, really nice. Okay, so I'm saying, what are you saying? I'm saying you can't necessarily judge a book by its cover, okay? Because there, you know, I can think of this one particular, they call themselves an institute, and they have to, their doctors and staff have to call over to the other hospital that people may think is less prestigious for help because they don't know, you know, exactly what they're going on, what they're, I'm not going to say what they're doing, but they're not as skilled. So again, you can't judge a book by its cover, okay? It's the moral of that little rant. But when you go there to the hospital, it may not be what you think it is or what you thought it was, but remember why you're there. But while you're there, one of the things that you want to do, and this is a plug, if you have family member, okay, especially if you have a family member and you are instrumental in encouraging your person, your friend, your loved one to go into the hospital, you want to be involved, okay? You want to visit. You want to get a chance to know who the attendings are. You want to get a chance to know who the clinical team is or the discharge planner is. You want to have a conversation. When you go there, if you're as a member, if you are the person being admitted, you want to ask questions. You want to attend the different groups. You want to ask, this is a time to ask questions of your doctor, to ask questions of your treatment team. You want to find out, okay, what's going on with me, to get educated, to learn as much as you can, okay? Ask questions about the diagnosis, about the medications. Find out about your discharge plan. Because again, as I said before, the goal is not to keep you in the hospital forever. As I said before, you know, people are only there for a couple of days. Whenever you're being discharged, you want to make sure that you have a good discharge plan, okay? You should have, if you're placed on medications, you should either have a prescription, you should know where you're going to be able to get your medications from. If you're able to fill your medications there in the hospital, do so. You should have an outpatient follow-up, right? You should know someone in the hospital should have made outpatient follow-up for you, right? That means they got in touch with someone in the community, a therapist and someone in the community who can see you once you're out of the hospital. Because once you're in the hospital, that's just the first step. Now the next step is learning how to live with a mental illness, because there's life. Just because you're diagnosed with a mental illness doesn't mean that you don't have a life to live. You still have a life to live, and that's where the outpatient treatment, that treatment team comes into play. That's where you begin to learn, okay, how do I live with the symptoms of my mental illness? And living is be a father, be a mother, have children, go to school, enjoy my life, right? Having a mental illness is more to it than just taking medications. There's more to it than just seeing your doctor on a regular basis or talking to a therapist. You have a life. You are a person who may be diagnosed with schizophrenia, a person who may be diagnosed with bipolar, a person who may be diagnosed with depression, okay? Whatever it is, but you still have a life, okay? So that's what we want to kind of keep in mind, is that you still have a life. That is what the outpatient team will do. You know, when you learn more about your illness, you begin to develop your crisis plan. You learn, you get a chance to interact with other people who are living with depression and who are living well with depression, who are living well with schizophrenia, with bipolar, or with PTSD. You begin to realize that there's a community out there, that you are not the only one. Okay, you'll get a chance to understand and see the different systems in play, and to meet the treatment team. So again, the inpatient psych ward is not the end of the world. It's actually the best place for a lot of people because you can stabilize your medications, you can get on medications, you can understand your diagnosis, you can begin to ask questions, you can begin to get the help that you need. But once you leave there, it's important for you to follow up with somebody on the outside. How long do you follow up? It depends. Some people may have to take medications for a short period of time, some people for a longer period of time. You don't need therapy forever. You may talk to somebody only when you need it. Some people think, oh, I don't want to see a therapist. You may only need to see a therapist to get some information, provide you with some resources, and then you drop in whenever you need to, okay? Your medications now, we have some medications where you don't have to take every day. You can take once, get an injection every 90 days or every 60 days. So there's a lot of things that can be done. Again, if you have to go into the hospital, it's not the end of the world. I would encourage you to do so. Just that if you do go, just remember, 1, you may have to tell your story to more than one person. 2, you may have to be prepared to wait. 3, you may not get admitted because the doctors, the treatment team there may decide to do other things to try to keep you from having to be admitted, because like I said, they may be able to give you medications there, let you stay for a few hours, and they may be able to get you outpatient follow-up as well. So while you're there in the emergency room, that team that's working, they may be able to call and make some phone calls and say, hey, Mr. Smith, we were able to, we're not going to admit you because we think you're doing well. We think that you can make it with follow-up. So hey, there's a prescription. I was able to call over to Dr. Jones, and she can see you tomorrow at 12 o'clock. Right? So that's the goal. They may do that. So again, but don't let the fear or the embarrassment or what people may say about you having to be admitted into the hospital or about you seeking help stop you. Because when you get to the emergency room and you talk to the person there, they may come up with some other ideas and strategies where you may not need to be admitted. But if you are admitted, just know that it could be a wonderful thing. It could be a great thing because now you're getting even more help that you need. So again, It's Getting Better All the Time Mental Health Outreach, providing information and support while encouraging hope and faith. You can log on to our website at igbatt.com. Again, make hope an option. No matter what you're going through, there is always hope, and never give that up.